He was standing alone in his kitchen when something changed. It was an ordinary moment, the kind that usually passes without notice, the kind that never feels dangerous while it is happening. His arm began to feel strange, not painful, just different, like it was no longer responding the way it always had. Heavy, slightly numb. Then, when he tried to speak, his words did not come out clearly. They sounded thick and slow, as if his mouth and his thoughts were no longer moving together. Many people would have frozen in that moment. Many would have waited, hoping the feeling would pass. Many would have told themselves it was just tiredness or stress or something minor that did not deserve attention. But he did not wait. He did not panic. He did one simple thing that gave his brain time before help arrived, and that decision changed what happened next. What makes this moment important is not luck. It is understanding. It is timing. It is knowing how the body behaves when something goes wrong. Most people are taught that strokes are sudden, unstoppable events, something that strikes without warning and immediately causes permanent damage. That belief feels frightening, and fear makes people feel powerless, but it is not the full truth. In many cases, a stroke does not destroy the brain all at once. It develops over minutes, sometimes slowly, sometimes unevenly. During those minutes, the body is still reacting. The brain is still trying to protect itself. What happens in that short window can influence how much damage occurs and how much function can be saved. The body often gives quiet warnings before it collapses. A strange weakness, a heaviness in the face, confusion that feels subtle rather than alarming. Many people notice these signs, but choose to wait. They sit down. They lie back. They tell themselves it will pass. That waiting is where damage grows. This message is not about what you should have done years ago. It is about what happens during a stroke, what the body is doing in real time, what the brain is losing minute by minute, and what one simple action can do to slow that loss while help is coming. This is not meant to replace emergency care or delay calling for help. It is meant to protect the brain while help is on the way. When people understand why something works, they remember it even under stress. And memory matters when fear makes thinking difficult. What mattered in this story was not strength, not medication, not forcing the body to act. It was timing, positioning, breathing, and allowing the body to respond the way it was designed to respond. To understand why this matters, it helps to understand what is happening inside the brain during the first moments of a stroke. When a stroke begins, blood flow to part of the brain slows or becomes blocked. Oxygen levels drop. Nerve cells stop communicating clearly. But in those first moments, many of those cells are not dead. They are stressed. They are struggling. They are waiting. Waiting does not mean failing. It means time still matters. The brain enters a kind of survival mode. Activity lowers. Signals reroute. The brain tries to reduce damage while it can. That is why early symptoms often feel confusing instead of dramatic. Tingling, heaviness, trouble forming words, confusion that comes and goes. These sensations are not random. They are warning signals. Many seniors are told that once a stroke starts, everything is already lost. That belief is dangerous. In reality, there is often a surrounding area of brain tissue that is threatened but still alive. This area can survive for several minutes if conditions improve even slightly. That is why early action can make a difference. Every second matters. And what the body does during those seconds influences how much brain tissue survives. This is where the idea of helping during the event becomes real. Not stopping the stroke completely, but slowing the damage. Emergency medicine focuses on restoring blood flow later, but this is about protecting the brain before help arrives. Seniors are especially affected during this stage. Aging brains are more sensitive to oxygen loss, but they also respond strongly to changes in posture, pressure, and breathing. Most people never think about these things during an emergency because panic takes over. The body stiffens, blood pressure rises, breathing becomes shallow, oxygen demand increases, and all of this makes the situation worse. The most damaging part of a stroke is not only the blockage itself. It is the stress response layered on top of it. Stress narrows blood vessels even more. It speeds up the heart. It increases oxygen demand at the exact moment supply is reduced. Calming the system is not comfort. It is biology. The man in the kitchen did not fight his body. He worked with it. Without even realizing it fully, he supported blood flow to his brain at the moment it mattered most. Before explaining exactly what he did, it is important to understand why so many seniors miss these early signs and why waiting feels reasonable in the moment. The symptoms do not feel dramatic. They feel confusing. Confusion delays action. Strokes rarely announce themselves loudly at first. They whisper. The brain becomes confused rather than alarmed. People feel off, not endangered. That false calm is dangerous. When oxygen levels drop, judgment weakens. Decision-making slows. The very part of the brain that needs help becomes less able to recognize that help is needed. People tell themselves they are fine, that they should not overreact, that they do not want to cause trouble. Fear of hospitals, fear of being wrong, fear of inconvenience all add to the hesitation. This is why education matters before an emergency, not during it. Once confusion sets in, clear reasoning is already compromised. In stressful moments, the brain does not rise to the occasion. It falls back on what it remembers. Rehearsed knowledge saves lives. This brings us back to the man in the kitchen. He did not decide what to do in that moment. He remembered. His body responded faster than his fear. That response lowered stress, slowed oxygen demand, and supported blood flow to vulnerable brain tissue. It required no strength, no medication, no special equipment. It required understanding how the body behaves under pressure. Before explaining the action itself, it is important to understand the principle behind it, because understanding prevents panic. Acting early separates recovery from regret. What buys the brain time during a stroke before medical treatment begins is not force or medication. It comes down to oxygen balance and pressure. The brain survives when oxygen demand drops faster than oxygen supply. That sounds simple, but in emergencies, most people do the opposite. Panic increases heart rate. Breathing becomes shallow. Blood pressure spikes. All of this raises the brain's demand at the exact moment supply is compromised. The brain is asked to work harder with less fuel, and that mismatch causes damage. The body does have built-in ways to protect the brain during low oxygen states. These responses shift blood toward vital organs and reduce unnecessary demand, but stress shuts them down. Calm activates them. This is why doing less can sometimes do more. Reducing strain lowers resistance and allows blood to move where it is needed most. The goal is not to fight the stroke. The goal is to cooperate with the body's natural survival systems to support circulation, to protect vulnerable tissue, and to buy time. Those minutes matter. Slowing damage changes outcomes. It reframes the goal from stopping the stroke to slowing the damage curve, giving medical care a better chance to work when it arrives. This approach is gentle, low risk, and does not require tools or training, but it only works if the principle is understood ahead of time. Under stress, Memory guides behavior. Knowledge without understanding disappears under fear. Understanding stays. Next, it becomes practical. How posture and positioning influence blood flow to the brain in real time. Why some positions quietly protect the brain while others make things worse. And why seniors are especially affected by these small changes. That is where everything comes together, where theory meets the body. Blood does not move on its own. It responds to gravity, pressure, and resistance. During a stroke, the brain becomes especially sensitive to these forces because blood flow is already reduced. This means that how the body is positioned can either help the brain or quietly make the situation worse. Most people do not think about posture during an emergency. They follow instinct. They pace. They sit upright and tense. They lie flat and panic. These reactions feel natural, but natural does not always mean protective. When fear takes over, muscles tighten throughout the body. Breathing becomes shallow and fast. Pressure inside the chest and head can rise. This added pressure makes it harder for blood to reach the brain at the exact moment it is needed most. For a brain already struggling for oxygen, this extra resistance can increase damage. The goal during these moments is not comfort. The goal is circulation. The goal is allowing blood to reach the brain with the least resistance possible. This is where posture becomes a tool rather than a detail. In older adults, this matters even more. Aging blood vessels are less flexible. They do not adjust as easily to sudden changes in pressure. Small shifts in position that a younger body might tolerate without trouble can have a much larger effect in an older brain. Without realizing it, many seniors worsen a stroke by straining, bracing, or holding their breath. The man in the kitchen avoided that trap. His body entered a protective state instead of a defensive one. That did not happen by accident. It happened because the response was familiar to him. He did not need to think it through. He remembered what to do. This brings up an important question. When should this approach be used, and when should it not be used? Timing matters, and clarity matters. This approach is meant for the moment when stroke symptoms appear and emergency services are being contacted or already on the way. Weakness on one side of the body, trouble speaking, facial drooping, sudden confusion. Action and calling for help happen together, always together. This is not something done instead of calling for help. Hospital treatment still matters. This simply protects the brain during the waiting time. There are also moments when this approach should not be used. If a person loses consciousness, if there is serious trauma, or if breathing becomes unstable, standard emergency procedures take priority. These situations require immediate medical intervention, and hesitation can be dangerous. Understanding this boundary is important because fear of doing the wrong thing can sometimes stop people from doing anything at all. Some seniors worry about blood pressure and wonder if changing position or breathing slowly could make things worse. This concern is understandable, but panic raises blood pressure far more than calm positioning ever could. The goal here is stabilization, not stimulation. Calm lowers oxygen demand. It steadies circulation. It supports survival. The man in the kitchen did not think he was stopping a stroke. He thought he was giving his brain a chance. That way of thinking matters. When people feel empowered rather than helpless, the body responds differently. Stress hormones drop. Breathing slows. Circulation improves slightly. Small changes add up. Once the science, timing, and boundaries are clear, the action itself becomes simple. This is where everything comes together. What exactly did he do in that moment? He lowered his body. He did not remain standing. He did not pace the room. He did not sit upright while tensing his muscles. He changed position deliberately and calmly. He lay down on his side, not flat on his back, not face down, on his side, allowing his body to relax rather than brace. His head was supported and slightly elevated, not high, just enough to reduce pressure. This position helps blood drain properly from the head while still allowing blood to flow to the brain. It reduces strain on the heart and lowers pressure inside the skull. That position alone helps the brain. But there was another important part: breathing. He breathed slowly and steadily through his nose. He allowed his breath to become deep and controlled, with longer exhales than inhales. This kind of breathing sends a signal to the nervous system that danger is being managed. Heart rate slows. Blood pressure spikes soften. Oxygen demand in the brain decreases. At the same time, blood flow is being supported by the body's position. The brain is asking for less oxygen while receiving steadier circulation. That balance is critical. That balance is what protects vulnerable brain tissue. He did not move unnecessarily. He did not shift, strain, or try to stand up again. Movement increases demand. Stillness preserves tissue. This can sound almost too simple, but simple does not mean weak. The body has relied on this response for survival for thousands of years. Side support, head supported, slow nasal breathing. This is not a treatment. It is a protective posture used while help is coming. It is especially important for seniors because older blood vessels respond more strongly to stress and pressure. Reducing strain can preserve function for longer. This is why his speech began to clear before the ambulance arrived. He did not reverse the stroke, but he bought time. And time saved brain cells. This is something every senior should remember, not with fear, but with confidence. Knowing what to do replaces panic with purpose, and purpose changes how the body reacts under stress. There is one more piece that matters deeply. Knowing this information only helps if it comes back to you when it is needed, under fear, under confusion. So how does someone make sure this knowledge does not disappear in the moment? The answer is rehearsal. Not physical rehearsal, mental rehearsal. The brain does not rise to the occasion. It falls back on what it remembers. This has been shown again and again in emergencies. Pilots, first responders, and surgeons train, not because they expect panic, but because panic removes clear thinking. Seniors deserve that same advantage. Mental rehearsal is simple. From time to time, when you are calm, imagine the early signs, the heaviness, the confusion. Then imagine the response, lowering the body, lying on the side, supporting the head, breathing slowly, no rushing, no guessing. Mental rehearsal activates the same pathways in the brain as physical practice. This means the body remembers even when the mind feels overwhelmed. That is why athletes visualize performance and why this approach works here as well. This does not need to be done often, not obsessively, just enough to make it familiar. Fear comes from uncertainty. Familiarity creates calm. Calm protects the brain. There is something empowering in this knowledge. Instead of waiting helplessly, seniors know they have a role, not to cure, but to protect. That shift alone reduces stress hormones and supports blood flow. The act of remembering becomes part of the protection. The body responds to preparation. Aging does not mean surrender. It means experience, awareness, and wisdom. In these final moments, there is one clear idea to hold on to. Many people believe survival comes down to strength, speed, or luck. But what helped in this story was none of those. It was memory and the body's ability to respond when the mind struggled. He did not fight what was happening. He did not try to outthink it. He gave his brain space, time, and oxygen. And that raises a quiet question worth considering. How many outcomes change, not because of what happens in the hospital, but because of what happens in the minutes before medical care arrives? Emergencies do not ask if you are ready. They reveal whether you are. If this knowledge is never needed, that is the best possible outcome. But if it is needed, remembering it could mean the difference between recovery and loss. Side support, slow breath, simple, human, powerful. The body already knows how to survive. It only waits for permission. When people hear this kind of information, they sometimes wonder if it is really enough. They think about hospitals, machines, specialists, and powerful treatments, and they question whether something so quiet and simple could truly matter. That doubt is natural. Modern life has taught us that big problems require loud solutions. But the human body does not always work that way. In moments of crisis, small adjustments can carry enormous weight. The brain is delicate, but it is also resilient. It has evolved to survive temporary threats, to protect itself when conditions become difficult, and to hold on as long as it can. What overwhelms the brain during a stroke is not only the loss of blood flow, but the added pressure of panic, tension, and unnecessary effort. When those layers are removed, even slightly, the brain gains time. Time does not mean the stroke disappears. Time means damage slows. Time means more cells remain alive when medical care begins. Time means better chances for speech, movement, memory, and independence to return. This is why calm matters so deeply. Calm is not weakness. Calm is a biological signal. It tells the nervous system to reduce demand. It tells blood vessels to stop tightening further. It tells the heart to slow instead of race. These signals are especially important in older bodies, where systems do not adjust as quickly as they once did. Many seniors have spent their lives pushing through discomfort. They are strong. They are used to ignoring pain and continuing forward. In daily life, that strength is admirable. In a stroke, it can work against them. The instinct to push, to stand, to pace, to shake it off increases strain at the wrong moment. Letting go, lowering the body, and becoming still can feel unfamiliar, but it is often the safer choice. It is also important to understand that this approach does not create delay. Calling for help should happen immediately. Help should already be on the way. This is not about choosing one thing over another. It is about using the waiting time wisely. The minutes before medical care arrives are not empty minutes. They are active minutes, whether the body is supported or stressed. Some people worry that lying on the side or breathing slowly could cause harm. That concern usually comes from fear of doing something wrong. Fear freezes action. Understanding removes that fear. This posture is gentle. It does not force anything. It simply removes obstacles to circulation and reduces unnecessary demand. It allows the body to settle instead of struggle. There is also comfort in knowing that this approach does not require perfection. It does not require exact angles or precise counts of breaths. It requires intention, lowering the body, supporting the head, breathing slowly, remaining still. These elements work together, even if they are not done perfectly. The reason this works so well for seniors is not because their bodies are weaker. It is because their bodies respond more noticeably to changes in pressure and stress. When strain is reduced, function is preserved longer. That preservation can make the difference between severe damage and partial recovery. This is also why remembering the sequence matters. In stressful moments, the brain cannot analyze new information. It relies on familiarity. The body moves toward what it knows. This is why mental rehearsal is so important. It turns unfamiliar actions into remembered ones. From time to time, it helps to picture the situation calmly, not with fear, not with obsession, just briefly. The early signs, the heaviness, the confusion, then the response, lowering the body, turning on to the side, supporting the head, slowing the breath, letting the body do what it already knows how to do. This kind of preparation is quiet, but powerful. It changes how the nervous system reacts under pressure. It replaces panic with direction. Direction changes physiology. There is dignity in this knowledge. It does not take control away from medical professionals. It supports their work. It bridges the gap between the moment something goes wrong and the moment treatment begins. That bridge is often where outcomes are shaped. As people age, they are often told to be cautious, to avoid risk, to accept limitation. But preparation is not limitation. Preparation is agency. It is knowing that even in difficult moments, you are not completely helpless. You have a role, a simple one, a human one. This message is not meant to turn anyone into their own doctor. It is meant to remind people that the body has built-in responses designed for survival, and that those responses work best when they are allowed rather than fought. The story that began in a quiet kitchen is not unique. Similar moments happen every day in living rooms, bedrooms, gardens, and sidewalks. Most people never hear about the small decisions that shape those moments. They only hear about outcomes. But outcomes begin earlier than most people realize. What happened before the ambulance arrived mattered. What happened inside the body mattered. What was remembered mattered. If this knowledge never needs to be used, that is a blessing. But if it is needed, remembering it could change everything. Not because it stops a stroke, but because it slows the harm. Not because it replaces treatment, but because it supports the brain until treatment begins. There is a quiet strength in simplicity, lowering the body, turning on to the side, supporting the head, breathing slowly through the nose, remaining still, allowing the body to settle instead of panic. These actions do not demand energy. They conserve it. They do not force blood flow. They allow it. The body already understands these signals. It has responded to them in moments of danger for as long as humans have existed. Modern life sometimes teaches us to ignore those instincts. This knowledge restores them. The next time your body feels off in a way you cannot explain, remember that whispers matter. Do not argue with them. Do not rush past them. Respect them. If help is needed, call for it. While help is coming, give your body the conditions it needs to protect itself. Survival is not always about fighting harder. Sometimes it is about stepping aside and letting the body do what it was designed to do. That is the quiet lesson here. Not fear, not drama, just awareness, preparation, and calm action. The body already knows how to survive. It only waits for permission.